The morning light filtered through the tall windows of Manhattan Medical Center as Emma Sullivan sat in the pre-surgery consultation room, her hands folded nervously in her lap. At 26, she had spent years struggling with a condition that had shaped every aspect of her social interactions, and today represented her chance to finally reclaim the confidence she had lost as a teenager. The door opened, and Dr. Michael Chen entered with a warm smile that immediately put her at ease. At 32, he was younger than she had expected, with kind eyes and a gentle manner that seemed at odds with his reputation as one of the country's most skilled reconstructive surgeons. His success had made him wealthy beyond most people's dreams, but he wore his achievements lightly, focusing entirely on the person in front of him rather than his own accomplishments. "Miss Sullivan," he said, settling into the chair beside her hospital bed, "I have reviewed your medical history and the consultation notes from Dr. Williams. I understand you are considering reconstructive surgery to address some scarring from an accident you had as a teenager." Emma nodded, unconsciously touching the left side of her face where pale scars traced delicate lines from her temple to her jaw. The marks were barely visible to most people, but to Emma they felt like neon signs announcing her difference to the world. "The scars are from a car accident when I was 16, she explained, her voice soft but steady. "They have faded significantly over the years, but they still affect how I see myself, how I interact with people. I have been planning this surgery for 3 years, saving money and researching the best surgeons." Dr. Chen leaned forward slightly, his expression thoughtful. "Emma, may I call you Emma? I want you to know that from a medical perspective, the scarring is quite minimal. The surgery you are requesting is certainly possible, but I always encourage my patients to think carefully about their motivations." "What do you mean?" Emma asked, though she suspected she knew where this conversation was heading. "I mean that sometimes what we think we need to change on the outside is actually something we need to heal on the inside," Dr. Chen said gently. "You are a beautiful young woman, and these scars you are so concerned about are barely noticeable. Have you considered that the real issue might be how the accident affected your self-confidence rather than how it affected your appearance?" Emma felt tears prick at her eyes, surprised by his directness and the compassion with which he delivered it. Most doctors would have simply scheduled the surgery and collected their fee. This man was actually trying to understand whether surgery was what she truly needed. "For 10 years, I have avoided cameras, declined social invitations, and turned down dates because I was convinced that everyone was staring at my scars," she admitted. "I know they are not as obvious as I think they are, but I cannot seem to convince myself of that." Dr. Chen nodded with understanding. "That is very common with trauma survivors. The psychological impact of an accident often outlasts the physical healing. Have you ever spoken with someone about the emotional aspects of your experience?" "UI. Mean therapy?" Emma asked. "I tried that a few years ago, but I kept thinking that if I could just fix the visible reminder, the emotional part would take care of itself." "But it has not worked that way, has it?" Dr. Chen observed. "Because every time you look in the mirror, you see not just scars, but the memory of that frightening day when your life changed in an instant." Emma was quiet for a long moment, processing the truth of his words. "Dr. Chen, are you trying to talk me out of this surgery?" "I am trying to make sure you are choosing surgery for the right reasons," he replied. "If removing these scars will genuinely improve your quality of life and help you move forward, then I am absolutely willing to help you. But if you are hoping that surgery will solve problems that actually require a different kind of healing, then we should discuss alternatives." Emma looked at this doctor who was willing to turn away a lucrative procedure in order to ensure she made the right decision for herself. In a world where cosmetic surgery was often treated as routine as getting a haircut, his careful consideration of her emotional well-being was both unexpected and deeply moving. "What would you recommend?" she asked. Dr. Chen smiled. I would recommend that you take some time to work with a counselor who specializes in trauma recovery, not because there is anything wrong with you, but because you deserve to heal completely, not just cosmetically. If, after a few months of that work, you still feel that surgery would be beneficial, I will be happy to perform the procedure. And if I decide I do not need the surgery after all, then you will have saved yourself an unnecessary medical procedure and discovered something even more valuable, the confidence that comes from accepting yourself exactly as you are. Emma found herself studying Dr. Chen's face, seeing something there that she had not encountered often in her adult life. Someone who was more interested in her well-being than in her ability to pay for his services. Dr. Chen, can I ask you something personal? Of course. Why did you become a reconstructive surgeon? Was it for the money, the prestige? Dr. Chen was quiet for a moment, considering his answer. I became a reconstructive surgeon because I believe everyone deserves to feel comfortable in their own skin. But I have learned that sometimes the most important reconstruction work happens not in an operating room, but in helping people rebuild their relationship with themselves. He stood to leave, then paused at the door. Emma, you scheduled this consultation because you wanted to change how you look, but I think what you really want is to change how you feel about how you look. Those are two very different goals, and they require two very different approaches. 3 months later, Emma sat in the same consultation room, but this time she was not wearing a hospital gown. She had returned for a follow-up appointment, not to schedule surgery, but to thank Dr. Chen for redirecting her toward the healing she actually needed. You look different, Dr. Chen observed as she entered his office. Happier. I feel different, Emma replied. The counseling helped me understand that I had been using the scars as an excuse to avoid taking risks, to keep people at a distance. Once I started addressing that pattern, I realized that the scars were never really the problem. And how do you feel about them now? Emma touched her face gently, but without the self-consciousness that had marked the gesture for years. They are part of my story. They remind me that I survived something difficult, and that I am stronger than I thought I was. Dr. Chen smiled with genuine satisfaction. That sounds like the most successful outcome possible. Dr. Chen, I have one more question for you. What is that? Would you like to have dinner with me sometime? Not as my doctor, but as someone I would very much like to get to know better. Dr. Chen's smile widened. I would like that very much, though I should probably mention that I have a policy about not dating patients. Good thing I am not your patient anymore, Emma replied with a confidence that would have been impossible 3 months earlier. Sometimes the most important healing happens not when we change ourselves to fit the world, but when we change how we see ourselves in it. And sometimes the best doctors are the ones who understand that true healing requires not just medical expertise, but the wisdom to know when the prescription is not surgery, but self-acceptance.